Welcome to Life Sutras, where we have empowering conversations with thought leaders that will inspire you to be a healthier and happier version of yourself. We will explore science, the subconscious, as well as the spiritual. Good health equals harmony between many dimensions of mind, body, environment, and the unknown. Welcome back to another episode of Life Sutras. And today we have a very spicy topic and a fabulous guest on our show, Dr. Mohit Khera, who's the best urologist in Houston, because my family goes to you, that's why. But more than that, he is the chair of urology at Baylor College of Medicine and a professor at the University of Baylor, right? You have a teaching position
Absolutely.
as well. Dr. Khera has authored two books, one Urology for Primary Care Physician and the other one with Mary Jo Rapini on relationships and sexual health.
That's exactly right. Yes.
So I won't keep you from the audience, and before we start into like the meaty topic, we would just like to know a little bit about your background. I know your father's also a physician. Sure. How did you end up in urology and just the backstory?
Sure. So first of all, thank you very much for having me on this podcast.
Thank you for coming.
Really, it's a pleasure and honor to be here. And so the backstory is I grew up in Houston. My father was a general surgeon here in town and went to a Catholic school here, all boys Catholic school, and then went to Vanderbilt University in Nashville, Tennessee. And when I finished my school there, I wanted to be the head of a HMO. I wanted to be a CEO of a big company. That was my dream. So I went to Boston, and they had a healthcare management program. So I did my MBA. Part of it was in Japan, part of it was in the United States. And then when I finished, I was an analyst for 2 years. The problem is that I didn't like it. I just didn't like being an analyst, and I was dating who is my wife now. She was in med school at BU, and every night she was studying these amazing things, and I was like making PowerPoint presentations, and I just said, this is not for me.
So the fruit doesn't fall far from the tree.
Yeah, so I started going to classes at night while I was there. I also ended up getting my master's in public health while I was there also. And then I came back to the University of Texas for medical school. And then after my medical school training, I was fortunate enough to get into Baylor Urology, where I did 1 year of general surgery and 5 years of urology here in Houston at Baylor College of Medicine. And then when I finished, I decided to super specialize and do a fellowship. And so my fellowship really is in men's health, sexual dysfunction, and infertility. And so that's what primarily I do. So 14 years ago now, I started my practice. And I have a basic science lab where we do research in the laboratory. We also have clinical trials that we run as well. And my focus has really been on educating other residents, fellows, and really just teaching men's health to others.
But you sort of also become the primary care physician for all your patients. How is that?
Well, so if you think about men's health and why people come to someone who specializes in men's health, they want to improve their quality of life, right? So they say to me, look, I have low energy, I have low libido, I'm depressed, I want to improve my quality of life. And I quickly realized that yes, there's things I can do medically to help you, that's true, but it's more than just a pill. It's lifestyle modification. So it is diet, it's exercise, it's sleep, it's stress reduction. We call that the 4 pillars. And I tell the patients, if you're not going to meet me halfway, this is not going to work. So you help me with diet, exercise, sleep, stress reduction. I will optimize your health. And it's not just about urology, it's about your cardiac health, it's about your GI health, it's about dermatology, it's about infectious disease. So I refer those my patients to those that can help my patients in those conditions. So, think about it, you could, your overall health condition plays a big role. Like, if you have poorly controlled diabetes, if you have a bad COPD, no matter how much testosterone or medications I give you, your quality of life still is not optimal.
Right.
So you really want to optimize every single one of those the facets.
But what do the stats say? It's like 1 in 10 people men complain of some sort of sexual dysfunction or
it's
sexual
way more
complaint.
than that. So let's think about this. So this is kind of sad if you're a man, just think about this. So 40% of men at 40, which is young, have erectile dysfunction. It's a lot. 50% at 50, 60 at 60, 70 at 70, 100 at 100. There's no choice, right? It's a natural part of aging. So these men come into me, 50 to 60 years of age. They say, Doc, how could this happen to me? I say, if you're 60, you're actually beat the odds, right? So it's a natural part of aging. Now, there are things we can do to help reverse it. And there's new technologies that are coming out, new things. Viagra does not reverse the problem. If a man takes Viagra today, the disease will continue to get worse until the Viagra stops working, right? But lifestyle modification has been shown in randomized placebo-controlled trials to reverse erectile dysfunction. Other medications such as, you may have heard of daily Cialis. I'm a big proponent of daily Cialis because every day it puts blood and oxygen into the penile tissue, and within 3 months, it physically makes it stronger, right? So these are things that can reverse the erectile dysfunction. And I do believe that testosterone has a role as well. So there are things we can do to make it better, but the statistics are alarming. 40% men at 40, it's a lot of people.
And is that the primary complaint? What are the other forms of sexual dysfunction?
There's many.
Educate our
let's
clients,
talk about
sometimes
it.
you're so shy to even address this topic.
Right, so erectile dysfunction may be considered the most common, right? But there's other types. 30 to 40% of men suffer from premature ejaculation. Not talked about very commonly, but 30 to 40% causes distress, anxiety, depression in these patients. Other men suffer from a disease called Peyronie's disease. Peyronie's disease is an abnormal curvature of the penis when it's erect. We believe that 7% of all men in the world suffer from this condition. And when the curvature is greater than 60 degrees, it's prohibitive for intercourse. So many of these men feel disfigured, they feel embarrassed, they're depressed, and there are treatment options for that as well. And so, those are the most common sexual dysfunctions that we see. We see low libido quite commonly. That's really important because, many
is that
men...
stress, mental health, or what are the...
It could be.
Yeah.
You think about it, low libido has many factors, and psychological is very important. So sex drive, it has a lot to do with the mind, right? And that's why I refer to Mary Jo Rapini a lot. There are 4 hormones that affect libido. I teach the residents PET. It's prolactin, estrogen, thyroid, testosterone. We check all those 4 because it could be an effect. And then there's something called neurosteroids, or just like things like dopamine. You may have heard of dopamine. When dopamine goes up in the brain, men and women want to engage in sexual activity. But when dopamine's low or serotonin's high, they don't want to engage in sexual activity. The problem is that many of the antidepressants that we have in the market are increasing the serotonin. So many women are on antidepressants and it plummets their libido. Many men are on antidepressants, plummets their libido. The only antidepressant that really doesn't decrease libido is Wellbutrin. It actually increases libido. So we talk to the patients about their medications and we try to change the medications if we can. But there's I should bring up something that's very important. In 2015, something amazing happened. In 2015, a medication called ADDY, ADDYI, came out. And it was the first drug ever to treat women for sexual dysfunction that was FDA approved. And if you went into Walgreens in 2015 and said, show me all the drugs that I can get for men, maybe 35 drugs, testosterone, Viagra, Levitra, but there were 0 for women. So it was a big deal.
That's interesting.
Very interesting. And what this drug does is you take it every day, increases dopamine, and it increases your desire for sex. So the FDA approved it as a drug that a woman takes every day and increases her desire for sex. So it was a big win, I think, for female sexual dysfunction. Now, recently, the second drug came out for women. It's called Vyleesi, and it's excellent. It's like an EpiPen where she puts the pen 45 minutes prior to engaging sexual activity. The medication goes in and increases her desire for sex. So now we have 2 drugs for women, and I think both of them are excellent medications. They work differently from one another. But we recently got permission from the FDA to give ADDY to men. So we're the only site in the country or the world that are giving AD to men in a randomized placebo-controlled trial, because I don't think men and women are very different when it comes to libido. I mean, when you talk about the brain. So that trial is currently going on at Baylor.
That's interesting to know. So you don't get into treating couples. I mean, you ever have situations where you know that, I know you're a surgeon and you can't surgically fix the situation, but do you ever get into situations where you have both couples come to you? Or
yes. So
how should people approach this situation? Because sometimes it could be the wife wanting to bring the husband, or, just want to give people a little bit of
Great question.
courage.
I'll tell you with a story. So when I started my practice, I was treating a lot of men. And I was very proud of myself. I was able to get these men these wonderful erections, great libido, things were fantastic. The problem is that they were married to women who were postmenopausal, they hadn't had sex in 10 years, and what was happening was they were going home and it was causing problems in the house, right? Because now these men want to engage in sexual activity. The wives were very upset. One woman called and said, look, we haven't had sex in 10 years, and now he wants to have sex all the time, and I don't. Right, and so you've created a problem, right, and it was happening over and over again. And I said, this is not going to work. You either keep both libidos low or both high, but you can't have a discrepancy, right? And so I went out to California. I trained with a very famous physician named Dr. Erwin Goldstein. And I went to his courses, and I learned female sexual dysfunction very early on. So I treat them both, because I tell patients, if I treat your wife, I'm actually treating you. If I treat you, I'm actually treating her. It's a couple's disease, right? So essentially, if you want to improve a man's quality of erections, this has been shown, you can skyrocket his wife's libido, and that makes a difference. It really does. But you can't. You gotta treat the couple. It's a couple's disease, right? So it's very important.
Interesting. This is so interesting. So I want to shift the focus a little bit to prevention.
Sure.
What are your views on prevention, and how early should kids start seeing you, just from a preventive standpoint?
So we look at certain things like guidelines. So when we talk about prostate cancer, the screening starts at 55, 55 to 70, unless you have a family history or at high risk. So then you would be screened in your 40s, and it's done by something called shared decision making. So that's probably the biggest thing that urologists take care of in terms of prevention is prostate cancer, second leading cause of death in the United States. So I think that's an important one. I personally think that every man should have his testosterone checked at least sometime in his 40s, just to have an idea. I think it's the best marker for men's health. For example, we do know that men with lower testosterone levels are much more likely to have a heart attack, a cardiovascular event. That's been shown. So that's in the AUA guidelines. We do know that some suggest that low testosterone levels may be implicated for men who have worse voiding symptoms. We do know that low testosterone could be a marker for erectile dysfunction, ED, low testosterone for low libido. So I think testosterone is the best marker for me for overall men's health. So I think it's important to have a baseline so that when you check it later on in life, when you're 50 or 60, you knew what it was when you were 40, because that's a really important point. Currently, we use a number called 300, and it doesn't make sense, but under 300, you are a candidate for therapy, and above 300, you are not. So essentially, if a man comes in at 310, theoretically he's not a candidate for therapy. But all of us are very different, and you can't have one number for every man in this room. Some men feel fantastic at a 250. Some men feel lousy at 350. And so it has to be individualized. And so when I started at Baylor, we started checking something called the sensitivity of the androgen receptor. Essentially, it's genetics. Some men require more testosterone, some require less. But it doesn't make sense to have one number for everybody. So a lot of times we don't fixate so much on the number, we fixate on the symptoms and the way the patient's feeling.
And what about HPV?
Yes.
And another question related to HPV is circumcision. Some people say it helps and it's like a prevention for HPV.
Yeah, so it can be. Circumcision can help reduce the HPV spread if you do it, but I am not a big advocate on doing a circumcision to stop HPV. I typically say that circumcision, if you look at the United States has one of the highest rates of circumcision, but globally, most men are uncircumcised.
Right.
Right. So, we do know that patients with uncircumcised can have a slightly higher risk of penile cancer as well, because of higher risk of HPV. But other than that, I don't advocate circumcision for a treatment. I think it's a cultural thing. I think some patients, when they have diabetes and they have something called phimosis or infections of the head, we do it to improve that. But it's not something that I say, it's a choice.
Great, great. Well, thank you so much. Now
Sure.
I'm going to throw a surprise question
Sure.
at you. And I ask all my guests on what's your secret life sutra?
I think it's prioritizing and putting what's important to you. To me, it's my family, right? So my family is extremely important to me, and that's the center. I have 3 children. I have my wife. My mom's still here in Houston. And putting what's important to you. I'm a man of faith, so it's very important. Every morning I pray, every morning I meditate. I think that's a really important thing to do. I practice what I preach. I think that I focus heavily on diet, exercise, sleep, and stress reduction. I feel like it's unfair to tell my patients to do it and then I don't do it myself. And I think those are the things that really keep me going.
Great.
Yeah.
Well, thank you so much for
Yes.
that you practice what you preach.
Yes.
And you look great. You
Thank
have
you.
a beautiful family.
Thank you.
And that itself is a testimony. So thank you so much for tuning in to this episode of Life Sutras. I've learned a lot. A lot of things have surprised me. And I'm sure you will help some people at least come out of the closet and address some of the problems that some marriages or some men might be going through.
Sure.
But thank you very
Thank you
much
so
for
much.
today.
Thank you for the
and
invitation.
Thanks a lot.
Thank you. Thank you.